Before anesthesia, patients could be held down by their arms and legs, bite down on a piece of wood, and endure surgery while fully awake. Today, you lie beneath a circle of white surgical lights. The room is so clean, it feels almost cold enough to frighten you. A masked person leans over you and says very softly, "Count backward from 10. You hear your own voice inside your head. 10, 9, 8, and then 7 never comes. There is no transition, no dream, no door opening onto the dark. One moment you are there, the next you wake up somewhere else. The surgery is over. But for you, it never really began. That is the strangest part of general anesthesia. It takes away the pain while the patient is not there to know it is being taken away. It is like a scene cut out of the film reel of your life, a blank space. And inside that blank is a very simple question. If I remember nothing, then where was I while it happened? General anesthesia is not deep sleep. Sleep is something the body enters on its own. Anesthesia is something medicine leads you into. Sleep still has cycles. Anesthesia is a state being controlled. In sleep, a loud noise can wake you. Under general anesthesia, you are not awakened by the one thing the body normally cannot ignore: pain. In ordinary language, it is almost as if medicine temporarily moves your consciousness beyond the reach of being awakened, and then keeps your body safe until you return. It is not magic. It is a state created by drugs, maintained through monitoring, and reversed when the surgery is finished. So what happens to a body when its consciousness is no longer inside it? From the Middle Ages until the years before the 19th century, surgery was usually the last resort. A leg taken off because gangrene had claimed it. A stone cut out of the bladder. No painkillers. The patient might be held down by the arms and legs, made to bite a piece of wood, and forced to endure the operation fully awake. Back then, surgery was a race against screaming. The better the surgeon, the faster he had to cut, because every passing second was another second in which pain was tearing the patient open. So patients dreamed of being absent from their own pain. Human beings tried alcohol, opium, sleep-inducing herbs, anything that could slow the body down, though none of it could make pain disappear. These things only pulled the patient a little farther from reality, far enough for the knife to do its work, but not far enough for surgery to become painless. Then, in the 19th century, what had once been a dream began to become real. In 1842, in Georgia, Dr. Crawford Long used ether to remove a cystic tumor from the neck of James Venable. On October 16, 1846, at Massachusetts General Hospital, William T.G. Morton publicly demonstrated ether during an operation. That day would later be known as Ether Day, the moment often remembered as the opening of the age of painless surgery. There was no screaming at all. The patient lay still while the surgery continued. From that moment on, surgery began to change. There is one strange detail that very few patients know before they reach the operating table. If you have natural red hair, your body may require nearly 20% more anesthetic than someone else's, even with the same weight, the same age, and the same overall health. The reason lies in a mutation in a gene called MC1R, the same gene that helps determine red hair. The surprise is that this gene does not only affect the color of skin and hair, it is also linked to the way the nervous system processes pain and responds to sedatives. That is why, before you enter the operating room, the standard dose written on paper has never truly been a number meant for everyone. It depends on quiet genetic factors you may not even know you carry. There is a very strange truth about the human body. It does not need you in order to keep working. The heart does not need you to remind it to beat. In the operating room, this becomes clear in a way that is almost frightening. You can no longer speak. You can no longer see. You can no longer remember. But your body is still an event in progress. Every heartbeat is a message. That is why, during anesthesia, someone has to be there to read your body when you cannot read yourself. This is the fear many people never say out loud. Not the fear of dying, the fear of waking up during anesthesia, waking when you are not supposed to wake, waking when your body cannot move, waking when your eyes cannot open. The phenomenon is called anesthesia awareness, awareness during general anesthesia. It is real, but very rare. Some literature reports that when patients are asked directly after anesthesia, the frequency is about 1 to 2 cases per 1,000 anesthetics. The number is small, but the fear is not. Human beings can endure pain if they can scream. They can endure danger if they can run. But the thought of waking inside your own body with no way to send a signal outward, it feels like being locked inside yourself. When the surgery is over, the anesthetic is gradually reduced. But coming back is not always like flipping a switch. Some people open their eyes and do not yet understand where they are. Some ask the same question again and again. Some cry without knowing why. Some recognize the face of someone they love, but a beat slower than usual. Not because they are weak, because consciousness does not return like a door thrown open. Sometimes it returns in pieces. Medicine calls certain states of confusion after surgery post-operative delirium. NCBI material describes it as a sudden, fluctuating, and often reversible change in mental state after surgery, especially noticed in the recovery area. Maybe no one explains anesthesia clearly because they want to hide it from you, because the truth is too hard to say briefly. Say too little, and the patient does not understand what they are handing over. Say too much, and the patient may panic before a procedure designed to protect them from pain. So medicine often chooses one simple sentence. You'll sleep for a little while. That sentence is not perfect, but it is humane. It helps the patient cross a door they have no choice but to walk through. Sometimes, in medicine, the truth does not only need to be correct, it has to be spoken in a way human beings can bear. A strange agreement between one human being and another. You sign the paper, you lie down. A stranger places medicine into your bloodstream, and the part called I begins to leave the room. Today, anesthesia is not just one thing. Medicine can turn off consciousness entirely with general anesthesia, numb a large region with regional anesthesia, numb a small point with local anesthesia, or simply draw a person into a dreamlike state with sedation. The goal is no longer only to make the patient free of pain. It is to choose the right degree of absence, far enough from pain, but still safe enough to return. Before an operation, you can ask, what kind of anesthesia will I receive? Who will monitor me during the operation? Are there any risk factors I should mention beforehand? What might I feel after I wake up? What should I tell the anesthesiologist? Those questions do not make you weak. They show that you understand what is happening. Maybe what human beings fear most about anesthesia is the feeling that they have been left out of their own body's story. Anesthesia is one of the strangest and most humane inventions in modern medicine. It allows human beings to be healed without having to pass through unbearable pain.